Hello, everyone. Thank you so much for joining me today and giving me your precious time and attention. I know how valuable it is, and I'd like to welcome you to our comprehensive overview of revenue cycle management in healthcare. Today, we will explore how RCM not only ensures the financial health of healthcare institutions, but also enhances patient care through efficient administrative processes. I'd just like to mention that I have a cold, and so I apologize if I do any coughing or if my voice is scratchy. Please bear with me. Okay, so with that, let's first talk about patient registration, the foundation of effective RCM. Incorrect information at this stage can lead to claim rejections or denials. For instance, a simple error in entering insurance policy numbers can delay the billing process significantly. And then there's charge capture. This involves documenting every service provided during a patient's visit. For example, if a patient receives an X-ray and a blood test, both must be recorded accurately to ensure proper billing. And then claim submission. It's crucial to submit clean claims to avoid delays in reimbursements. A clean claim is one that has no errors and can be processed by the insurer without additional information. Using automated systems can reduce errors, so we call those clearinghouses. We send the claim through the clearinghouse first to check for errors before it gets sent on to the payer, and this helps reduce errors significantly. Once it goes to the payer, then we hopefully see reimbursement. This step involves tracking claims to ensure they are paid. So on our end, the reimbursement step is tracking and following those claims. It's important to follow up on delayed payments because time is of the essence, right? There are time limits on claims. For instance, using a dashboard that tracks the status of each claim can help identify which claims are paid, denied, or pending. Excuse me. And then patient collections. After insurance, any remaining balance is billed to the patient. Of course, this depends on who the payer is. But in your case, that might be the situation. Clear communication about financial policies at registration aids in smoother collections later, so the patient should know up front, wherever possible, what their out-of-pocket expense is going to be. And then once the claim has been paid or denied, and the patient shouldn't be billed while this is still going on, but if the claim has been denied, we need to handle the denials efficiently. It's crucial that they're handled effectively and timely. For example, if a claim is denied due to a coding error, the billing team needs to correct and resubmit the claim promptly. Okay, so why is revenue cycle management important? Well, first let's talk about financial health. Effective RCM directly impacts the profitability of healthcare facilities. For example, by reducing the rate of denied claims from just 10% to 5%, a hospital can significantly increase its revenue. When you think about the entire revenue of one hospital, and of course that varies depending on the hospital size and volume, but if you think about how much is 5% versus 10%, that could be, the difference between the two could be a really huge number. Next is patient satisfaction. A smooth RCM process means fewer billing errors, leading to higher patient satisfaction. In other words, they're getting billed for what they should be billed for. They're not receiving the bill too early before the process with the payer has been completed, or payers. And so the balance that they are billed is correct. And hopefully it's been communicated correctly up front as well. Transparent billing practices help in maintaining trust and reducing confusion. And then there's regulatory compliance. Compliance with regulations like HIPAA and accurate coding practices are critical. What happens if we're not compliant? Well, it can lead to heavy fines and legal issues, of course. And nobody wants that. Okay, let's talk about complexity of billing and coding, and boy, can it be complex. The ever-evolving nature of medical billing codes like ICD-10 updates yearly require constant vigilance and training on the part of the coder, billers who are entering these codes, and anyone involved, really. Providers need to be aware and conscious of documentation needs so that the correct codes are captured. You know, the right severity, the right specificity. So they need to know what information needs to be in that documentation. So this is ongoing, and this is why we do CDI audits, so that we can not only keep coders and billers up to date, but we need to prevent queries by getting the right information where it starts, and that's with the patient visit with the provider. So if the provider isn't aware, they can't do what they're not aware of. So that's why we do these. It's why we do queries, it's why we do training, and why we do audits, so that providers can be aware of what needs to be in that documentation, so the correct codes are captured, so that the claim is paid appropriately and is compliant. With constant changing regulations, regulations are frequently updated, affecting how claims must be processed. So staying informed through seminars and industry updates is essential. Yes, time-consuming, but essential. And technology integration is helping with that, though. I think it's helping to save providers, coders, billers, HIM supervisors, payers, everybody more. It's helping save time all the way around. Integrating new technologies with existing systems can be challenging, but it's necessary for efficiency. So, for example, the transition to an advanced EHR system might disrupt operations initially, but can streamline processes in the long run. Yeah, there may be some downtime where you are paper charting and then have to play catch up on entering things into your EMR just to make that transition or to make that add-on. But hopefully, you have good programmers working on that, and it's quick and efficient. That's the best we can all hope for. And here I just want to share with you a timeline of healthcare regulations and RCM updates, just so you can see some of the major updates that have happened over the years. Unfortunately, my view is small, so I'm going to look at my other monitor. But so in 1996, we had and this only goes back to 96. Of course, it's things have been going on longer than that, but 96 we had the introduction of HIPAA. That was major, and we had to update everything to implement the privacy and security measures that we see today. And, it's still an ongoing process. It's still a struggle. There are data breaches sometimes, but it improves all the time. In 2003, we started enforcing HIPAA, so everyone was required to be updated by then. And patients needed to consent to what happens with their information. And then 2010, along comes the Affordable Care Act. So again, we needed to update and handle new types of plans, a lot more government sponsored plans, often managed by private payers. The ability to check eligibility needed to become more streamlined. At this point, everyone was expected to be covered. Remember, there was a penalty if you were not covered. In 2013, the final omnibus rule update to HIPAA occurred. So again, more updates required, and penalties were induced for non-compliance. People were expected to adhere to these new practices were expected. And then in 2015, we went from ICD-9 to ICD-10. And this is around the time that I actually became a coder, and I actually had to learn ICD-9 during the transition, and then also learn ICD-10 because I was seeing charts from the previous year that would be coded in ICD-9 and moving into ICD-10. So for those of us that, that became coders during that time, we had to learn both at once. Those that were coders prior to that already knew ICD-9 and had to learn and update their skills to ICD-10. But also, all the systems had to be updated, the coding systems. And ICD-10 is much more detailed and much more comprehensive than ICD-9. So, and there's a lot more codes. In 2019, we had the introduction of the patient-driven payment model for skilled nursing facilities. Again, another update needed. And billing had to be adjusted, and payment criteria changed. And then in 2021, the price transparency rule enforcement. Once again, an update. So we also call this no surprises. So we needed to make it clear what the pricing and what the patient would have to pay. So this is just kind of a high level. There's been a lot more things that have happened, but these are the main things. Main regulation changes and updates required over, 96 to now, I guess the past 8 years. So that's just for your information. And of course that's in the United States, but if you're somewhere else, I'm sure you've seen your own regulatory updates over the years. Okay, technology. Technology really is the driver, isn't it? It seems like a lot of times. So technology utilization. Often we implement cutting-edge technologies like AI and machine learning to predict patient billing issues and automate routine tasks. For example, AI can help in predicting which patient accounts are likely to become delinquent. With training and education, Regular workshops and training sessions keep the revenue cycle management team updated on best practices and regulatory changes. This investment in education pays dividends in reduced errors and improved efficiency. And I would add the physician team to this also, a provider team. Patient communication is important. We develop clear policies for patient financial responsibilities and communicate them effectively at every point of service. Providing patients with easy-to-understand billing statements can reduce confusion and improve payment times, and now it's required by law. Okay, so now let's have a look at a case study with City Health Hospital. City Health, I'm going to have to go to my other monitor again, I'm sorry. But City Health is an urban 500-bed facility, and the challenges they were having were that they were having high denial rates and long claim processing times. So from that, it sounds to me like the bottleneck was in processing denials, and if those claims took too long to process, they were probably expiring and not able to collect on them. So what did they do about it? Well, first of all, they implemented best practices, which were technology upgrade. They introduced an AI-driven RCM system. This made documentation and other key tasks very much more efficient for the providers. They also provided more staff training, monthly workshops on coding updates and claim filing procedures, mainly for the coders, but I believe also for providers in terms of documentation and how to document to get those codes entered correctly. And then patient communication enhancement. They streamlined billing inquiries and clearer financial responsibility disclosures. So they created a system to respond to those inquiries, plus they disclosed and gave more information to the patients up front, so there was no question, hopefully, for the most part. So how did this work out for them? Excuse me again. Before, they were averaging 45 days on their claims, and they were able to reduce that to 25 days. So 20 days faster, that's pretty significant. They were receiving an 18% denial rate, and by through their training and probably through the AI system also, they were able to correct those billing mistakes or the lack of documentation or whatever it was that was causing the denials, and they reduced it to 8% from 18%. So, 10% difference, 10% of their claims, right? So that can be very significant financially. And of course, this all had an impact on healthcare delivery, but they focused on providing excellent care, of course. They increased their patient satisfaction because any issues or concerns with billing were resolved much more quickly. Claims were processed more quickly, and patients weren't sitting there wondering how much they were expected to pay. And with all this, they saw a revenue increase of 15% in cash flow just by making their billing more efficient. So you can see the difference it can make. And, you know, in a larger hospital, that could mean millions of dollars, and, you know, it's relative. You know, it's still a big number for smaller practices or hospitals as well. Okay, I'm not really sure what's going on with the display of my slide. It seems like it has come back, so hopefully we can continue. This is the last slide anyway. I'm just backing up. Okay, so today we covered the essential aspects of revenue cycle management and its impact on healthcare management. Looking forward, the integration of advanced data analytics will play a pivotal role in shaping the future of RCM, making processes more predictive and personalized. I'd like to thank you for your time and attention today. Remind you that this is just the opinion of the presenter, myself, and by no means is it legal, financial, or any other type of advice. Before making any major changes in your practice, you should definitely consult the appropriate professionals. Also, this is copyrighted material, and please reach out if you before using any of it. So also I have failed to put the slide in with my contact information, but there is a contact form at helpfordocs.com. It's HELP, the number 4, DOCS.com, or you can email at tony@applebergconsulting.com, and Appleberg is spelled APPELBERG. And so if you have any questions, comments, or concerns, you're welcome to drop a note in the chat, the comments, or just reach out to me in one of those forms of contact, and I'd be happy to help to the best of my ability. And since today is the 4th of July, I hope you all have a great holiday.